Hi, I'm Chris Campbell.
And I'm Dana Harvey, and we welcome you to 15 News. Did you know that arthritis is a condition that refers to over 120 different types of diseases that can affect joints, muscles, and other soft tissue? Well, Providence Hospital recently started its fall lecture series, which shows how to deal with arthritis. Numerous patients, volunteers, and the interested public were in attendance at Providence Hospital's lecture series, which looked to shed more light on a common affliction, arthritis and bone joint pain.
Today I thought the program was very informative, and I especially liked it because I am a candidate. I have arthritis spreading through most of my limbs, and it has puzzled me, and doctor explained in great detail what was going on, and some of the ideas that he gave me, I can help the situation. And I'm also a candidate for a new knee. So he also told me things that would help in the interim while I'm waiting for my final decision. Of course, I have to tell you, I've been putting it off for a couple of years, but I think after listening to him today, I probably will proceed with it.
The lecture was presented by Dr. William Higginbotham, orthopedic surgeon for St. John's Providence Hospital, who also looked to dispel myths and misconceptions about arthritis.
I think that the biggest misconception that patients have about hip pain, joint pain, and surgery is that it's a very painful experience and that they somehow are going to be limited and not able to do their normal activities. And I think they don't understand that today we have many kinds of modalities that can help their experience be much more comfortable, and that we're really oriented towards function, and that our best patients are the ones that we want to get back to their regular functional activities.
While joint pain and arthritis affects many, Higginbotham feels that the best way to prevent or manage it is by simply leading a healthy, active lifestyle.
I think the best thing that people can do is generally to try to be healthy. You hear very often the doctors talk about not living a sedentary lifestyle, not eating the wrong kinds of foods. From my perspective, for healthy joints, you need to have flexibility, you need to have some strength and comfort when you're doing things. So moderate, low-impact exercises, a good diet, enough rest, these are all things that can make you live better and function better. And I think those are good things that you can do to minimize the symptoms if you have some problems with your joints.
The lecture was part of a series presented on common afflictions and the trends used to treat them. Providence staff feels that the lectures will greatly benefit the community, doctor and patient alike.
I think they're beneficial to the community because they allow the doctors to talk to the patients. You get to hear them actually as they ask questions in a regular setting. In the setting of the doctor's office, you're sitting there as a doctor, a patient is consulting you, there are time pressures. But in a situation like this, people can see what you have to say, and they can ask the questions as they feel them and as they live them. So it gives you a little better sense of what's going on. It helps them understand some of the things that you're dealing with when trying to help them.
To learn more about the Providence Hospital Lecture Series, visit stjohnprovidence.org.